Did you know that only 34% of young people around the world can demonstrate accurate knowledge of HIV prevention and transmission, and that 2 out of 3 girls in some countries have no idea of what is happening to them when they begin menstruating? These are some of the reasons why there is an urgent need for sexual healthcare access. According to the World Health Organization, sexual health is defined as a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. It depends on access to reliable information about sexuality, knowledge about the risks and consequences faced in engaging in unprotected sexual activity, ability to access sexual health care and living in an environment supporting sexual health.
But doesn't this access to sexual education depend on the country we're living in?
To a certain extent, yes. For example, a 2019 public health study shows that Sub-Saharan Africa has a higher burden of HIV and AIDS, as it is the leading cause of deaths among adolescents. It is also underlined that sexual education is important from the start of adolescence, as it is at this period that risk-taking behavior, such as unprotected sex, start to appear, increasing risk of unintended teenage pregnancy and spread of sexual transmitted infection. In Sub-Saharan Africa, up to 25% of adolescents aged between 15 and 19 years have had sexual intercourse before the age of 15, and HIV/AIDS is the leading cause of death among adolescents aged between 10 and 19. In Nigeria, according to a study on the delivery of adolescent responsive sexual ed and reproductive healthcare services in Plateau states, only 1.2% health centers indicated the availability of the 4 recommended essential sexual and reproductive health services, such as counseling and information provision, provision of contraceptives, testing and treatment for STI, or post-abortion care. This happens despite the fact that Nigeria signed an international agreement in 1994 committing it to ensuring the provision of adolescent sexual and reproductive health services.
In that case, does the lack of sexual education happen only in underdeveloped countries?
No, it also happens in developed countries. In the United States, sexual education relies on individual school districts, which creates inconsistent policies and practices within the states. The sex education someone receives can come down to what school district they live in or which school they attend. In Florida, the Republican-dominated legislature wants to launch a draft law in order to strengthen state control over sex education. They want to ban any instruction in schools about menstrual cycles before the 6th grade. Children in 6th grade are 12, and many of them are already menstruating, as the average age is between 12 and 13. Florida has already passed a raft of laws limiting discussion in schools of gender and sexuality and reducing the emphasis on diversity in public schools. Republicans defended their law as a way to make sex education more uniform statewide and give parents more leverage over curricula, although in many families sexual education is never discussed and a lot of kids only learn about sexual education in school. Planned Parenthood is opposed to this law, as they state it is presenting a reductive and binary view of sex and stigmatizing LGBTQ students. For them, the gap between the sex education students need and what they actually get is wide. The Guttmacher Institute found that adolescents were less likely to report receiving sex education on key topics in 2015 than they were in 1995. The Centre for Diseases Control also found that fewer than half of high schools and less than a fifth of middle schools teach sexual education. In France, the law plans at least 3 annual sexual education sessions in middle school and high school. However, it remains the school's mission to plan them. In a lot of cases, the number of these annual sessions is not respected, especially in private Catholic schools where LGBTQ sex is not even addressed.
How does this link to the prevention of irresponsible sexual practices and the spread of STIs?
Well, for instance, sexual education is directly linked to prevention of risks of alcohol and drug abuse. A public health study shows in 2019 that adolescent sexual intercourse, and more especially sex with multiple partners, was strongly correlated with substance use. Sometimes the law in itself isn't clear on what you have the right to access. In Ireland, if you are under 17, the law is unclear as to your right to be prescribed contraception. Some doctors will prescribe contraceptives to young people under 17, but others will refuse. It's the same for emergency contraception. If you are over 16, you can get the morning after pill from a pharmacist without your guardian's consent. If you're under 16, you will have to provide a consent to the pharmacist. However, Ireland is a good example of healthcare services on university campuses. A great number of them offer these services in order to prevent and treat STI and promote positive sexual health practices among students. Sometimes that's not the case in all countries. Overall, sex education and healthcare access are things lacking in a great number of countries all over the world.
Now, I wonder, what implication does this lack of sex education have on the spread of STI?
This lack of knowledge manifests itself under different forms, especially when approaching the issues of STI and STD. Indeed, through history, there were many outbreaks of sexually transmitted diseases, some deadlier than others. We would like to take a look back at the spread of HIV and AIDS to portray the importance of sexual education. This STD contagion reached a peak in the 80s when it became a global sanitarian issue. At that time, ignorance and prejudices were pretty common around this disease. Gay men and people from the LGBTQ+ community, sex workers or drug addicts, were thought to be the only victims. They were seen as outcasts. Public opinion was pretty judgmental. People were also scared of the patients because of a lack of knowledge and education about the disease. The inability to stop the epidemic was also met by some big sanitarian issues, such as the contaminated blood scandal, where blood contaminated by HIV was transfused to healthy patients across Europe, especially in France or the UK. People had to wait until 1985 for the clinical trials for a cure to start, 4 years after the first cases got reported, thanks to the action of the World Health Organization. Scientific intervention helped to identify what were the causes for AIDS. HIV was discovered and shown to be contagious to everyone. The fact that it was a sexually transmitted disease was finally made clear. As WHO would write, condoms were a basic but critical tool in stopping the epidemic. Countries started distributing condoms all across the world and put more emphasis on the need to use protection. Another thing that changed the course of the pandemic was the possibility of being tested. Detecting sick people allowed them to be treated and to potentially prevent at-risk behavior.
But the disease had a differential impact across the world on the population, and even if a cure might provide patients with a better chance of survival and better living conditions through the disease, HIV is very much still present. For example, sub-Saharan Africa's leading cause of death in 2000 was HIV. This can, in part, be explained by an economical factor. Indeed, the antiretrovirals, which were the only drugs efficient in helping relieving patients, had a very high price that many countries could not pay through their public treatment programs. Other scholars, such as John and Pat Caldwell, suggest that this might be due to the presence of other STIs that would increase the probability of getting contaminated by HIV, such as syphilis, highly present in Eastern and Southern Africa. According to WHO, among 38.4 million people living with HIV in 2021, 25.6 million were living in sub-Saharan Africa. Adolescents are particularly at risk. 71% of new cases would be among adolescents. Again, the lack of access to tests and prevention are big factors. From this, we can really understand that prevention is essential. As Dr. Naoko Yamamoto, Assistant Director General for Universal Health Coverage and Health Systems, would say, ending AIDS is unlikely to ever happen without an integrated health system that provides HIV prevention, diagnosis and treatment, as well as care with other essential health services.
I would also like to add that prevention is not only about HIV issues. That's why we address those other matters in the following podcast. Thank you for listening. I hope it was informative for all of you. Next time we will tackle the issue of teen pregnancy and child marriage.